Hey everybody, this is Mark Newgent here with Dr. Thermos. Before I turn you over to the doctor, I just wanted to point out I'm running for city council, and I've noticed a lot of candidates paying lip service about I care about you, I support this, I support that. So instead of saying thoughts and prayers for your family, I just thought I'd bring you a really good doctor instead. Since I can't bring a doctor to everyone's house in a population of 276,000, the best we can do is we can have a doctor live. So this is for the replay audience. So we're just going to get into it, and as people join us, our campaign manager and technical assistant Nisa will be reading off the questions. And I hope you guys can hear her.
Hi.
And we'll go through it. So I'm just going to go right into it if you want to.
Sure.
You already have the questions. And try to get relaxed. You could broadcast as long as you want. So try to look there. Are we in frame?
Yes,
okay,
you are.
We're in frame.
You guys look
Okay,
great.
Look thin. Get
Yes, you guys look great.
So, Dr. Thermos, can you tell us a little about yourself, your professional education as a doctor, what schools you go to, tell us about your practice?
Yeah, thanks for having me here, Mark. Number one, I want to make sure that we talk about your campaign while we're here too, because as you know, I'm a big supporter of yours and always have been, and really encouraged you to go through with this and running for the city council. Yeah, I'm a DO, a doctor of osteopathic medicine. I had practiced initially as a chiropractor before I went to medical school, and I did my residency at the University of Nebraska in Omaha, Nebraska, and trained in family medicine, always knowing that I was going to do more of a holistic type practice, and then it kind of developed my own direction as far as how I'm taking that, and doing a lot of regenerative medicine now, doing a lot of hyperbaric oxygen therapy for patients, intravenous nutrition and hormone imbalance, etc., addressing those issues for patients along the way. So what kind of things do you think that they'd like to know?
Well, I got a bunch of questions here as I showed you before. You said family medicine, I didn't know that. So did you do pediatrics?
I certainly did. I did everything including pediatrics. I even had delivered babies. I delivered over 100 babies during my residency.
Oh, wow.
Oh, wow.
So I've taken care of virtually every age group through my career at this point in time. I decided to give up delivering babies because it just wasn't prudent in Omaha, Nebraska with the way things were, and time schedules and such, but I enjoyed that too.
Awesome, because one of my questions later on was, again, background in pediatrics, because we have a lot of parents of young kids that support our campaign, and that support me. So that's what interesting. So that we jumped right through it. Yeah, awesome. So I kind of assumed that while we're broadcasting, there'll be some moms at home that have sick kids.
Sure.
And they might actually ask you questions live. My son is actually out sick today.
Oh, I'm sorry to hear that.
Oh, it's just the usual petri dish first week of school.
Right.
So he went to school for a day, got sick, took a day off, went back to school, got sick again, and then 2 days off. So we'll try to go back to school tomorrow.
Majority of those issues that kids are dealing with coming out of school, most of those are viral type things, and the parents make a lot of mistakes from the perspective of they think they need to rush their child to the doctor's office.
Okay.
And more often than not, these viral illnesses are very self-limiting, and if you can address things like hydration, making sure that their diet is fairly mild, they can do very well, and you can manage majority of things at home, and kids do not need to go to the physician's office for an antibiotic.
Awesome. Okay, I see people are joining us. If you guys give us a thumbs up on sound as well. Sandra, I think you know who that is. She gave us a thumbs up, and some other, I recognize some other mothers, some young moms from our community. So I have a list of questions.
Sure.
Also, you are, full disclosure, he is my doctor too, so you're actually the only doctor I've ever told everything. Like, you know everything about me. You know, most of the time in my life, you tell a doctor this, hold things back, but you really honestly know everything about me. So,
I consider that a privilege, Mark. Thank you very much.
Dr. Thermos has also treated my brother, my wife,
me,
four or five of my friends.
My daughter.
One of my brothers flew from Hawaii over to see Dr. Thermos. We have a close friend, I'm not going to say who, he flies from East Coast to see Dr. Thermos as well. And you're in Lake Forest, right?
Actually, right in Laguna Hills, right on the edge of Lake Forest.
Okay. And I will, Sandra, if you're watching, can you post your guys' website in the comments? But because of Facebook won't allow me to put it in the description because nobody will see when it goes out. So if you guys can post your website, other people can see it in the comments. And then also you take care of the endocrine system?
Right, yeah, I do a lot of bioidentical hormone replacement. There's a lot of hormone issues that people have developed over time, some due to environmental issues, some caused by like the number of birth control pills that were given out to young girls when they're younger. I believe that's created a significant amount of problems. And what's in the pollution in the environment, the heavy metals are known to create issues with the endocrine system, and the imbalance, it's like a series of dominoes. Once you create one imbalance, it affects another area, and it's not uncommon for people to have multiple endocrine difficulties after they've developed one after a period of time.
On that, what's the most common hormone prescribed?
There's quite a few people out there that have thyroid issues out there. Thyroid issues are numerous throughout the entire United States when people care to look for it. Unfortunately, physicians in practice have been lulled into a false sense of security that doing one test is oftentimes all that's needed in order to figure out what's going on with the thyroid itself. But actually there's a series of 5 tests that really need to be done if you really suspect that there's a thyroid issue taking place. Oftentimes they aren't done, and so there are a lot of low-functioning thyroid patients that are out there that have a whole host of problems that they're medicating with other medicines for when it's actually a thyroid problem to begin with.
Unfortunately.
So on the thyroid, is there any at-home remedies that you can get to maintain a healthy thyroid?
Well, one of the things that's really important, I think, is getting iodine in your diet, and of course getting the iodine from fish. And basically sea fish along the way, and you've got to get good clean fish along the way. But iodine is a huge issue when it comes to thyroid balance along the way, because you need iodine in order to make the thyroid hormones themselves. And without the iodine, there's a deficiency that occurs, and that's why the Midwest is known as having the goiter belt, because they had very few imports coming from either coast, and they wound up iodizing the salt for those patients in the Midwest. And then they had all kinds of problems with too much salt in people's diets trying to get the iodine in, so that created its own whole.
So you said fish. Now we have a vegetarian at the table right now that doesn't eat fish. So what do you recommend for the vegetarians?
So there's a lot of sea vegetables and such like that are also available that can be harvested and brought in. And those can provide quite a bit of iodine and such like that for the diet too. Kelp, kelp is one of the #1 sources, and people can take even kelp tablets.
We actually have a question.
Okay, what's the question?
Can you tell us the difference between PRP and stem cell therapy? What are the benefits?
Okay, well, it's kind of out of order there. Thanks, Sandra. Yeah, so PRP is platelet-rich plasma, and what that talks about using is pulling the patient's serum, taking their blood from their arms, spinning it down, and separating the plasma from the red cells. And at the very bottom part of the plasma are the platelets, and the platelets contain, we had thought that they were only good for helping with coagulation type issues, but now we know them to be full of, be like Ziploc bags full of growth factors. And when you take those growth factors and you import them into an area where there's, let's say, a tendon issue or a joint issue, torn muscle issue, by replacing those growth factors right at the site of the injury, you can speed up the whole healing process.
Oh, wow.
Is that something you guys do?
Yeah, we do PRP. I've been doing PRP for quite a long time, long before it's become in vogue here, and even have my own protocol that I've developed that I use, which is different than most offices. We also do a lot of stem cell therapy. There's the autologous stem cell therapy, where we actually harvest the stem cells from the patient and concentrate them and then give them back to the patient in a concentrated form. And then there's also the allogeneic stem cells, where we get them from, for example, umbilical cord. We get them from a tissue bank, and where they concentrate them and have grown them, and we administer those to the patient. And the stem cells can be used to help regenerate tissues as well. We use them for joint issues as well as a lot of neurologic type issues.
Is that for older or younger or all ages? All
ages. I mean, it really has quite a varied amount of applications. It's more per the disease process, kind of determines who is a candidate and who's not for stem cell therapy.
I'm here, but I can't hear you over the band.
over the band.
What is this?
Oh, they must be.
What does this mean?
They're at a rib. It says a rib cook-off.
Oh, I don't.
They're at an event. That's what they're saying.
Oh, okay.
I see the comment.
I don't know what that means.
So I know they're thinking it sounds expensive. So is that an affordable treatment for people?
Oh, it's definitely an affordable treatment. I mean, when you compare it to things like people putting braces on patients' teeth, you know, and it having a permanent effect on them, that's what the stem cell therapy and the PRP therapy is. They are both permanent type fixes for situations along the way, and so it's definitely affordable.
I want to talk about myself for a second. You see my blood work? You get some free medical advice here. Do I need any of that? I'm just. Well, I got my doctor here.
Do you want to talk about this?
Well, not too. We're looking for a yes or no question.
Yes, you could.
Okay, we'll talk about that in the next.
Yeah.
I just had a checkup with Dr. Thermos. Really quick. I know you're going to know the answer to this one. How often should we get our blood checked? And see someone like you.
Well, when somebody becomes a patient in my practice, I generally like to check and if they have, let's say, an endocrine problem, I generally like to check that approximately every 3 to 4 months along the way.
Okay.
So as to make sure that we have things balanced, because things can change,
yeah.
Especially as people's lives change, as stresses change, the requirements for the hormones can change, as well as weight changes. For example, if somebody goes up 20 pounds or down 20 pounds, that can mean a huge swing as far as like the hormone availability, and we need to make adjustments as far as to what they're taking, as well as to support them with nutrients as far as to what they need in order to maintain their hormonal balance.
Yeah, I'll share a little bit about my own for the audience. I do my blood test, Dr. Thermos, every few months, like he says, and then I take the vitamin D, vitamin C, and he, advises me every few months and keeps me very healthy. And so I just thought that would be something to tackle.
Sure. Yeah, nutrition is a huge part of this whole thing, because it's not just hormonal balance, but it's also, for example, number one thing I see in a lot of patients today, just because the American diet is so saturated with carbohydrates, is they don't get enough protein in their diets along the way. And when you don't have an adequate amount of protein, things don't heal as well. Muscles don't heal as well, especially when somebody's working out as often as so many of my patients do. But some hidden type things that are not oftentimes thought of as well is the use of protein in order to make neurotransmitters for the brain, for the chemicals that the brain uses in order to communicate between the neurons. Those have a basis starting out with the breakdown of proteins into the amino acids, and those amines then are transferred and made into neurotransmitters. And those neurotransmitters are what help make our thought, help us transmit messages, the sense of touch, help us to feel pain, help us to perceive vibration, etc. So protein has a cross application for a lot of different systems, and I see so much protein imbalance here amongst the patient population that I tend to take care of.
Yeah, I'm trying to get more protein also. I did my shakes today.
Good.
Over at the gas station, I have they have the 25 milligrams or grams of protein, and now they have the 40 grams of protein, the protein shakes.
Oh, that's good. That's good. The big thing that I'd like to emphasize to people too is when you're getting like a protein shake, make sure it's low in carbohydrates. So many of the garbage protein shakes that are out there also have high carbohydrate contents in the shake, and
Sandra
that's
has
not
a
good
question.
thing.
Okay, don't forget to share the broadcast also, so we can get more people. Okay, so Sandra says, would stem cell therapy benefit someone with Parkinson's and/or dementia, and how?
Okay, so for example, like with Parkinson's disease, Parkinson's is a degeneration of an area of the brain called the substantia nigra, and you get a decrease in production of what's called dopamine as far as a neurotransmitter. And so using stem cell therapy, by giving that to the patient, that can encourage those localized stem cells in the brain to indeed proliferate on their own and help balance the neurotransmitter output as far as dopamine goes. And patients experience quite a bit of improvement by using something like stem cell therapy. With dementia, it's really important that if there's an early stage dementia, that they get treatment right away, because as the brain deteriorates after a period of time, some of those neurons cannot indeed bounce back along the way, and so oftentimes there are vascular issues, and doing things like hyperbaric oxygen therapy can help reestablish a circulatory supply.
What is a hyperbaric?
Hyperbaric oxygen is I trained in hyperbaric when I was in the Air Force initially, and we place a patient in a chamber and it's a heavy metal chamber, so we can raise the internal pressure, although you can't perceive the pressure changes very much other than the pressure changes that you feel in your ears. Much like when you're flying an airplane, you don't feel the pressure changes other than your ears popping and such. But by increasing the pressure in the chamber and having the patient breathe relatively 100% oxygen, we can improve the saturation of the tissues.
Oh,
we can
wow.
saturate the plasma with 100% oxygen and get oxygen to tissues that have been starved of oxygen for a period of time.
I've read about something like that. It's amazing.
Sun Yi just joined us. Sun Yi has 2 young girls, I think.
Hi, Sun Yi.
Yeah, I brought you a pediatrician, Sun Yi. A real doctor. Also, he's an anti-aging
DO.
doctor. Did we talk about that already? Your anti-aging stuff?
Well, anti-aging stuff is kind of a really broad term, and it has to do with combating the problems of degeneration that happen with aging. A lot of oxidative processes and such, and decreases in circulation. So anything that you're doing in order to try and heal tissue, trying to help restore the tissue, is anti-aging. So it's not like we're trying to make anybody live forever along the way. We're trying to improve their quality of life so that whatever time that God has them here on this earth, that their quality of life can be good and they can be enjoying the life that they have instead of spending it going in and out of doctors' offices and hospitals, etc.
Okay.
So
Awesome. Okay, so a quick question: are you taking new patients?
yes, absolutely. We take new patients. They're always on schedule. Walk-ins don't work out very well with our office by the nature of my practice, because I tend to like to spend a lot of time with patients, and if I don't have the scheduled time to spend with them, it's not as useful for them or for myself at getting to the bottom of their problems.
Yeah, I think I've been seeing you about 3 years. You've been my doctor.
Yeah, right about that. About that.
Yeah, you're like actually as long as I've had any doctor. I think.
Even with the Army?
Oh, the Army's just whatever you get. It's just whatever guy you get, So it's just whatever. You know what it is. You were in the Air Force.
When I was in the Air Force, we had a general clinic that was set up, and then we had a time where people could make appointments, and I was able to keep a certain number of patients through it. I got to see them throughout the entire time that I was in the Air Force, which was really a nice situation, because I got to see families progress with delivering babies, etc. I got to interact with the entire family and be a part of that entire process, and that was really a blessing, which I'll always miss.
Okay, I'm sitting here inviting people. I don't be rude. And I actually just invited a bunch of people, and someone actually I know actually had a stroke.
Oh,
that I invited, and she might watch this in replay. So I'm just wondering, could you do anything for a stroke victim with your stem cells?
So number one problem with a stroke, I mean, there are 2 types of strokes. There's the embolic stroke, where there's a clot that moves and blocks up a blood vessel. Okay. And of course, there's the type of stroke that happens when a blood vessel ruptures. In both cases, you wind up destroying the circulatory supply to an area as far as the brain goes. And so the number one thing that has to be done is help reestablish the circulation to the brain. So there's been a lot of data actually put out on this, and using, it's not conventional medicine, but using hyperbaric oxygen, which is something we were talking about earlier. One of the things that hyperbaric does is it stimulates new blood vessel formation. So there's been plenty of studies that demonstrate that now this angiogenesis, stimulation of new blood vessels, can actually help revascularize an area that's been injured. The area that's dead is dead. I mean, that tissue's not going to come back.
Yeah, she has some slight paralysis one side, walks the cane.
But the area right surrounding those tissues is also compromised, and so there's a lot of still live neurons in that area. And so by reestablishing the circulation can really help help those neurons to spring back to life, and then that's where stem cell therapy can then be possibly used to help bring that part of the brain again.
Yeah, I don't mean to interrupt, doctor, but you have a comment. She says, "Best doctor ever."
No.
So please share the broadcast. And
thanks, Victoria.
And Sandra, if you could post, or there's camera. Sandra, if you could post the website of the Wellness Life Source. What is it again?
LifeSourceWellnessCare.com.
Okay, so Sandra, I know you're watching. You could post it in the comments section, and then Victoria could actually go make an appointment to see the best doctor ever. He's my doctor, so of course I think you're the best doctor.
Well, thank you, Mark. Thank you.
And get another one. Hey, Dr. Thermos, I agree with Victoria.
Yeah, I won't say too much, but it's nice to see old patients of mine from a long distance away just giving us a wave here too.
Well, you know them?
Oh yeah,
okay.
I've known him from a long time ago. You bet. Yeah.
Awesome. Okay, yeah. Share the broadcast, guys. And Nisa, if you could also.
I am
people.
actually.
Yeah. That was it. hopefully, maybe that I'll reach out to that one person that had the stroke, and I'll give her your number.
Sure. Yeah,
Maybe,
I'd be glad to see if we can help.
Okay. And again, Dr. Thermos does have a background in pediatrics, and I didn't know you delivered babies.
Oh yes, yeah.
That's awesome.
Yeah, they used to staff the labor and delivery department by when I was there, because it seemed like even my attending physicians when I was a resident had said that when I was there, they knew that they would get swamped with babies, and I set a record there at the hospital that I delivered 6 babies in one night, one time in an 8-hour shift.
Oh.
So for one physician to go through 8 mothers and deliver them all and through things, I was exhausted.
Wow.
But that's a memory I'll cherish for forever as well.
Yeah. So I kind of wanted to be a doctor, or I really did, about the MCAT books and everything. I think I told you this story, but then I started dating a nurse, so that was good enough. But this one major, and I was like, I'm gonna go to medical school, I'm gonna come back as an officer, kind of like what you did. I wanted to be a doctor in the military, and one major, she's like, why don't you become an officer first, and then we get you in medical school. Okay, and then I excelled as an officer, and I've been telling people, the first half of my military career was kind of normal, not really extraordinary. But the second half, I just excelled, and because as an officer, you're a bit of a politician, so I'm good at that. So I was able to get through the job as a second lieutenant, get the job as a lieutenant colonel, much higher, and advise 4-star generals and do the much
Oh, it's great the impact that you can have when you're there
as an officer.
As an officer in the military. I mean, I would echo that. I really loved the time and the people that I met while I was at Offutt Air Force Base in Omaha, Nebraska. If there's anybody in Nebraska, I'd give a shout out to y'all out there. But yeah, I was at Erling Bergquist Hospital, and it was really fun in that in the department, I was in the Department of Family Medicine there. In the department, they realized that there were a number of patients that wanted alternative medical type care. And so that didn't work in the traditional setting that we had there. So they allowed me to set up a separate clinic. And so I came in during off hours, and we held evening clinics where patients could come in just looking for alternative medicine type stuff, practice, and looking at alternatives to using the traditional prescription medications and traditional approaches to things. And that was really a success. And even they had installed a chiropractic clinic within the hospital there while I was there, and that's worked out really well for them at Offutt Air Force Base. So I'm really proud to say that I was a part of that, and glad that's continued.
Okay. Yeah, I was trying to figure out a way to share this to the Irvine Moms page. I think that you would have value to them. That's why I was looking down on my computer.
Yeah.
Is there a way that you can copy and post it to them? They're probably going to be upset that they missed a free pediatric appointment.
Yeah, it's unfortunate.
See if somebody could post it to that page. You might, not sure.
Yeah, I'm not sure how to do it, honestly.
Okay. I have to copy and paste it. I'll do it real quick.
I tried to do it on OC Moms.
I'll do it real quick. It's going to break the continuity of the video, but it's okay. Yeah, I'm a member of that. They would like that.
Thoughts on IVIG therapy for low hemoglobin?
Is there a specific condition that they're thinking about?
Is there a specific condition?
IVIG is basically taking immunoglobulin and transfusing it into a patient because of an immune system deficiency. And the problem is that traditional medicine has oftentimes skipped past some of the things that cause these immunodeficiencies along the way. And sometimes it's a nutritional problem, sometimes it's a hormonal issue, and those things get missed all the time. Sometimes it's a poisoning issue, for Pete's sakes.
He's saying CLL.
Okay.
Chronic lymphocytic leukemia?
Chronic
CLL.
leukemia? I don't know, probably.
That if there's a deficiency in order to help prevent infection, I can see the transfusion of the IVIG.
Yes.
But oftentimes there are things that can be done in order to stimulate the patient's own production of their own IgG along the way, so that they can defend themselves against the different pathogens that are out there. So there are a lot of things that can be done.
Okay. Well, I successfully shared it to the Irvine Moms page. So maybe in a few minutes people get the notification.
Sure.
Yeah, I didn't realize the whole background. That's pretty awesome. So,
Especially the stem cells.
yeah.
I didn't know about this either, so anybody can benefit from it.
Yeah, so stem cell therapy is like a broad spectrum of patients that can be helped with that. I can tell you about a fellow that was in his 80s that had come to us, and his ejection fraction, which talks about the heart's ability to pump the blood through the body, was in the low 30s. And being in his elderly situation that he really wasn't a candidate for traditional medicine therapy, and he just asked if there was anything we could try, and so sure enough we did. We used the umbilical cord cells intravenously for him.
Wow.
And then had a follow-up echocardiogram done, I believe it was probably 4 months afterwards, and his ejection fraction went from the low 30s to the mid 50s. Now that's
wow.
really important in that 50 is considered normal. So he had a very poorly performing heart that normalized completely after 4 months. So he was very happy, and he was a wonderful guy. He was a caretaker for his wife, and his big concern was that his heart was getting so compromised that he wouldn't have to be able to take care of his wife, and so he needed to get stronger so as to take care of her. A real true love story, and needless to say, he was able to bounce back and continue to take care of his wife, and she didn't have to go into a nursing home, and to my knowledge, he's still looking after her today at home.
Awesome.
Yeah.
Wow, this is great.
Okay. So can I keep one more question?
Sure. Yeah.
I just wanted to. That's
As
a
long
good story.
as much as you guys want to know, I'd be glad to share.
Okay. I was going to ask another. I think kind of covered this though, but what do most of your patients need nowadays? Now you talk about your past pediatrics and delivering babies, but in your current private practice, what do most of your patients need, and does that vary on age?
That does vary on age. I guess one of the things that I've noticed about the patients that have come to me here in the last 10 years is that there's a chronicity of the illnesses. Most of the problems are chronic in nature and have been over-medicated or poorly diagnosed, and patients have been misled into thinking that there was nothing that could be done to help them along the way. And that's where I love to step in, and I love to open the doors and shine the light on some of the dark spots and see if we can't come up with other diagnoses and things like that which can be treated, which can improve their quality of life, and that can have a cumulative type effect. And so the chronicity of the illness, I think, is the thing that impresses me the most, is the number of patients having problems that have gone on and they've suffered with for so long a period of time that just haven't been addressed.
Okay. You mentioned the other day about, we're talking about diets and stuff. You said you have cancer patients. So I'm going to read the question here. Are we good on the frame?
I'm just putting you in the frame.
Okay. So do you have cancer patients? If so, can you tell us what are you doing for them? The other day you told me at my checkup that you recommend the keto diet for your cancer patients.
Correct. So cancer patients, oftentimes they come in having had really poor diets earlier, and one of the things we know about most of the cancers, and I'd say better than 98% of the cancers that have come through my doors, are addicted to sugar themselves. I mean, they will survive if you continue to feed them sugar, and if you starve them of the sugar, you tend to quote, mess up their metabolism along the way because they need the sugar in order to survive. And so the ketogenic type diet focuses more on the use of proteins and fats and breaking those down as energy sources and pulling the carbohydrates out of the diet. And when you do that, then that stunts the activity of the cancer itself. In fact, there was a study published probably 2 years ago which looked at treating breast cancer just using a ketogenic diet and hyperbaric oxygen. Those being the only two treatments that were instituted for the study along the way, and it showed that they were able to stunt the growth of the tumor, which is pretty amazing considering what we do in this country between the chemotherapy and the radiation therapy and the surgical process. If you can do some tremendous things just with diet and then supplying things like oxygen to them in concentrated amounts, that's a great positive change in their lives and decreased morbidity. They have a lot less difficulties, and during their recovery, and have a lot less consequences as far as the recovery itself.
Speaking of cancer, I don't really want to talk about it because she published it publicly on social media. My friend's wife, she's got diagnosed. I just invited her. Hopefully she'll join the broadcast.
Sure.
Yeah, she was posting about her chemo treatments and stuff too. So maybe.
So the patients I see are basically at all stages. I mean, I've helped take care of patients that have not done any chemotherapy or any treatment prior to coming in to see me, and I kind of guide them. I do think that some of the cancer treatment therapies that are out there have some value, but oftentimes there's a lot of neglect as far as looking something as simple as diet. In my mind, it doesn't matter what treatment the patient chooses, they have to clean up their diet.
Yeah.
Diet is critical to the success of any therapy along the way. And so it doesn't matter which treatment course that they embark upon, they need to really focus on their diet. And the ketogenic diet, or at least if the ketogenic diet is too strict for them to be able to adhere to, I try to gear them towards a zone type diet, which is definitely a lower carbohydrate type diet, and that makes a huge difference in their lives.
Okay.
Yeah.
Okay. So earlier we talked about the endocrine system and the hormones and stuff, and a lot of guys right now, I think in my age bracket, are curious about testosterone and estrogen treatments and things like that. I bump into my friends in the military, they're aging, testosterone levels. Could we talk a little bit about that?
Sure, yeah.
And
So testosterone is a hormone which has been abused in the past by a lot of folks for bodybuilding purposes, for sports, etc. Unfortunately, it leaves problems to develop later on, as well as there's a lot of issues with just the environmental things that we talked about before, the heavy metals and such, suppressing the hormone production. And so it's not uncommon for a man to walk in my office that's in his 40s to have the testosterone level of a guy that you would expect to have in his 70s along the way. You'll say if he's in his 40s, he's got a lot of life left. And so if we can uncover some of the issues that have contributed to those hormone deficiencies and boost their production, or inhibit their conversion into, say, let's say estrogen. Sometimes that's one of the problems that happens for guys, is that their testosterone is getting converted to estrogen. If we can block that, we in essence push their testosterone levels up, and they can have a better quality of life and things can work better. Of course, that's a very you have to be very careful with what you're doing and be watching things, and that's why I watch the lab work extensively with these patients.
Question about your thoughts on Arnold-Chiari syndrome.
Arnold-Chiari syndrome?
Chiari?
yeah, that question right there.
Okay. So that has to do with the brainstem getting trapped at the base of the skull. And one of the things that I think needs to be addressed, and that the traditional medical community never addresses with something like this, is they look at the opening there and they see that opening is narrowed, and so it places some pressure on the brainstem itself. And so they surgically excise some of the skull so as to open the foramen magnum, which is the opening of the base skull. They open it larger. And you have to cut all kinds of tissues in order to get down to the skull like that, and that can create a real problem with a lot of scar tissue later. And oftentimes they can create neurologic injury as well. One of the things that needs to be looked at is from a functional standpoint. I have a bias because I practice as a chiropractor first, and being an osteopath, and both those two professions really recognize the use of manipulation in order to free up locking that can take place in that upper neck, which can functionally narrow that opening. And if you can open that up and free that tissue up so it is more freely mobile, sometimes that can make a difference. I'm not going to say that in all cases of Arnold-Chiari that can work, but I can tell you in 100% of the cases that have come through my doors that have been treated for Arnold-Chiari syndrome surgically, that has never been a consideration from the medical standpoint. And I think that really people need to back up. Surgery should always be the last choice in any type of situation, not the first choice. And a traumatic fracture or something like that, that's an absolute indication for surgery to be done. But a chronic condition, to jump on surgery as the first treatment of choice, I think is a huge mistake, because you can never undo a change that scar tissue once it's set up housekeeping in the area.
Okay. I hope hope we answered your question. No, I think Christine answered that question. Or what's your name? Okay, we had other comments. Fred, I think one of your friends said, glad you're on our side.
He and I went to chiropractic school together.
Oh, okay, cool. I wanted to talk about the testosterone stuff a little more because I know a lot of guys that they may be reluctant to do a lot of stuff and they get testosterone on their own. Now, I'll talk about hypothetical patient also. But I remember you said it's important to check for cancer before you take testosterone or any hormone.
Exactly right.
Because it causes it to grow, right?
And for example, in the case of a prostate cancer along the way, if a patient doesn't know that they have a prostate cancer and they take exogenous testosterone to boost their levels, that can actually amplify its growth along the way. And so somebody can create a problem. There's a perfect example of a guy by the name of, a lot of folks will probably remember him, his name is Lyle Alzado. He used to play for my Denver Broncos way back in the days. And then he wound up getting traded to the Oakland Raiders. He used a combination of testosterone and growth hormone, and unfortunately had a liver cancer that he wasn't aware of at the time.
Oh, wow.
And he actually accelerated its growth so quickly that there was no treatment available for him. And so by the time it was from diagnosis to death, I believe it was 6 months.
Wow. Yeah, so if you're going to take hormones, go see the doctor, get the blood test, and see this guy. And also, hypothetical patient, I know somebody that was going to the internet doctors, did do the blood test, everything, but they were selling him way more stuff than they needed. And then comes out with a blood test, another doctor, he didn't need anything but pure testosterone because his body could process it.
Yeah, well, that's I see both scenarios happen. Unfortunately, people are undertreated and people are overtreated along the way, and I think it's just a matter of just taking the time to figure out what each individual patient needs and not giving everybody the same rubber stamp along the way.
So basically, a simple blood test, come see you, have it,
and sit down and talk about it and kind of find out what's taking place, because the history can, a patient's history can also tell me a lot as far as to what's taking place with them as well. We
had another comment from that same Kimberly. She said her daughter was born with that syndrome.
With Chiari syndrome?
Yeah, that's what she said.
Okay, and that's why I say it's really important, because that's a chronic type situation, and if she has the narrowing of the opening there at the foramen magnum, having somebody that's experienced as a good chiropractor or as an osteopath, somebody to take a functional look at that and see if functionally they can improve it before surgery becomes the first choice.
Okay, I'm just inviting people to join us. They're going to be like, I missed the doctor. I promoted. I even put a little sponsored content.
Oh, did you?
Yeah. So anyway, let's get my second window. Okay, so I got more questions, more people joining us. Figured this is a good time, just they're getting off work. Yeah. We still got 6 people watching us live right now, and I've seen probably maybe 100 kind of cycle through, because people will, as they're going about their day, they'll join us.
One of the funnest thing that Dr. Thermos does is that blood sample that he does under his microscope.
The live blood cell.
The live blood cell.
This is.
I was just this week, a few days ago. It was last week. I went in there. You had to fast 4 hours prior, and I went in there and showed the blood on the
under the microscope.
So the whole idea, what we're doing there is looking at getting a window in time into what's taking place in your body right off the bat. By taking a sample of blood, we can see some things that are changing along the way or not changing, things that could compromise your ability to deliver oxygen to tissues, indications as far as relative amounts of inflammation that's going on. If there's a lot of aggregation, clumping of the cells, well, that could be a problem. It could be as a result of cholesterol issues. It could be as a result of an inflammatory situation like an autoimmune type condition. And so getting a window as far as to what's taking place inside the patient can be really helpful at making treatment decisions so that we can get on the path, and not just looking at lab work that's on a page and going off numbers.
But the greatest part is the patient can see it.
Exactly, and so you can understand what's going on.
Yes.
And the great part about that too, Nisa, is that they can see changes.
Yeah.
So after treatment, I bring them back, and then we draw that same blood sample to take a look to see what's taking place, and if they've had something like a condition known as poikilocytosis, which the cell membranes are really vulnerable to oxidative damage, and we've been able to improve the patient's nutrition, their production of those red cells, they're healthier red cells, and you can see a huge change in them.
Wow.
That the cells themselves are healthier, and you can see that they're functioning better. And I guess that also helps encourage my patients so that they can stay on the right path, so that they're doing what they need to do, so they can get healthier and stay healthier along the way, and realize that it's not just a rote exercise and just I just need to take this because he told me to take it. But they can see that there's a change.
That is true.
I think that's really important.
That is very important, and it's cool.
Yeah, I've always been a science geek, and things like that. I've always really gravitated towards, because I'm a very visual person, and I think most of America are very visually oriented. And I think if you can fix in your mind a picture as far as to what's taking place, you can wind up learning a lot about what's taking place in your body and correct it and get on the path that you need in order to get well.
Yeah.
Okay.
I like that process.
Inviting people here.
Yeah.
Are you able to invite anybody else?
I was.
It's just in my screen.
So
this is a little homemade broadcast here, but okay, what else we got? So, you're gonna invite more people? I invited a couple of the people I know are cancer survivors that are suffering right now.
I invited my sisters. Two of my sisters are cancer survivors.
Oh, so let's just talk about that for a minute. So oftentimes the cancer survivor has been through a traumatic process just in trying to survive the cancer, and oftentimes they've had many toxic type things done to them. And whereas they may have physically survived, they also have a lot of chronic things that they've developed since that whole time. Like, for example, like a neuropathy is a really common type situation, be it as a result of radiation or be it as a result of the chemotherapy. A lot of times those things can be addressed and treated, and traditional medicine doesn't have a lot of good treatments for those sort of things.
That's true.
And so those poor patients are left with having survived something in a brush with death along the way. Then they're left to suffer the rest of their lives and some of the things that they have. And by improving their quality of life, that there's nothing like having more life, but having great quality go along with it. And I think that's what needs to be addressed. So there's this whole population of cancer survivors out there that because they've survived, they're just kind of shuttered off to the side, like, okay, you survived, be thankful for what you have. And I think what needs to be addressed is how to improve their quality of life, detoxifying them, helping them turn things around so they can have enjoy their lives and things can function better and not spend the rest of their lives in pain and suffering. And
100%.
And get rid of the brain fog that they have. You know, there's so many cancer survivors that have this terrible brain fog as a result of the chemotherapy, and those kind of things can be treated.
Oh, wow.
And just like you're expressing right now here, Nisa, a lot of people don't even know. They think that that's their cards they've been dealt, and that's what they're.
I have a friend that has the brain fog. He lives with it because of cancer treatment, chemotherapy, to be exact. And he thinks that's it. There's no solution.
And I'm here to tell you that there is no panacea. There is no one fix for everybody for the situation, but looking at the individualized patient therapy that they went through and figuring out, well, what caused things to go wrong and trying to correct those factors is the best solution to try and help them come back. And even if they only recover 50% of where they were, that's still 50% more than they would have had if they do nothing, which is an improved quality of life. So that's
amazing.
And wife joined us. You missed us on. We're talking about the keto diet. You know, did you see the video of us that we made? My wife's keto diet.
No,
she lost like 30 pounds. Look good. She's already tiny. So I mean, she's like
yeah. Good for her.
She looks 20 right now. She looks amazing.
I am all for it, Tanya.
Yeah, she's watching us. Okay, so I got plenty more questions. I just wanted to get a bunch of people in here. It hasn't been that long. And again, you say you're taking new patients?
Yes, absolutely we are.
Okay, and then we'll do a little bit of review because we've got a bunch of new people.
Sandra is like, what are some of your treatments at your clinic for cancer, hyperbaric, or IV therapy?
So one of the things that patients come in with, oftentimes after having been through chemotherapy, is they get nutritionally depleted, like Nisa and I were talking about just a few minutes ago, and replenishing some of those nutrients. And sometimes they can't absorb them fast enough because their gut's been destroyed, and so we replenish that with intravenous infusions. University of Kansas is doing a big study with the National Institute of Health, and they have a cancer clinic that's devoted to just using infusions of intravenous vitamin C. and at the University of Kansas, and they found tremendous response for those patients, not mattering whether they've been through chemotherapy or not, or had radiation or not, or had surgery or not. In every instance across the board, the intravenous infusions of the vitamin C helped make things, help the patient do better, and they have increased survival rates, increased quality of life assessments, and that's not my just saying that's taking place. People can Google that themselves now at the University of Kansas and find out that that's really what's taking place, and you won't hear that in many of the oncologist offices around town.
That's good. What about the glutathione?
Glutathione,
whatever that is.
So glutathione is a really strong antioxidant, and people wind up getting depleted of glutathione for a variety of different reasons. For example, one of the things that really knocks levels down being produced by the liver is Tylenol use. I mean, how many people get around and take Tylenol? Okay.
I'm one of them.
large amounts of Tylenol will deplete the glutathione in the liver along the way, and so the liver uses glutathione as far as its ability in order to detoxify the things that come through. The brain uses glutathione in large amounts, for example, like we were talking about earlier, a Parkinson's disease patient. Yeah. There's a famous neurologist who's down in Florida who started treating his Parkinson's patients with intravenous infusions of glutathione, and he's got videos up on his website. It's Dr. David Perlmutter out of Florida. Yeah. And so I attended one of Dr. Perlmutter's lectures many years ago, and so I started doing intravenous glutathione for Parkinson's patients, and the results are amazing.
Really?
The results are really amazing. You can really turn things around for these people. And so glutathione is an antioxidant that's really underutilized. And the big problem is it's such a large molecule, it's really hard to absorb from the gut, so there's a lot of different ways to get it in. Before we used to only be able to do it intravenously. Now there's dermal ways we can get it in by driving it across the skin. There are nasal inhalation methods. There are ways to nebulize it and get it in the chest. For patients with COPD, they have terrible inflammatory type situations that are going on as far as in the lungs, that are just destroying lung tissue. Oh. And by using the inhaled glutathione, you can slow that process down. You can turn the inflammatory process down. Yeah. And it's using an antioxidant. It's a prescription antioxidant, but I have the patients mix it up at home, and you can nebulize it. And
but you are doing it as an IV therapy at your office?
Oh yeah, we do the IV therapies at our office.
That's really great, because I don't think anyone is doing it like that.
There aren't very many. There's a few.
There is? Okay, that's good. But I know you, so I would go to you. It lightens the skin as well, if anyone cares.
So we've got another questions. Okay, no, they're just talking to each other in the chat, not us. Okay. Have you worked with any psych or any PTSD patients?
Yeah. So for example, depression is rampant, needless to say, in our country, and there's a lot of problems. There was even a discussion of a poor pastor who just took his life here just this last weekend up in Rancho Cucamonga, I believe is where he's at. And anyway, depression is everywhere, and just our society, just the amount of noise that people are exposed to, just the amount of chemicals that they're exposed to. There's all kinds of different contributing factors to depression, but the number one cause, as far as even the traditional medicine textbooks will say, as far as depression, number one organic cause of depression is low thyroid function. We were talking about thyroid issues earlier. Yes. And so I can remember one fellow who had come into me when I was back in practice in Colorado, and he was on like 7 different psych medicines for his bipolar depression that he had, and he had some other health issues, which is why he sought my help out. And I told him in advance that these things could be contributing to his depression, and so we wound up treating him for those. It raised his testosterone levels, straightened out his thyroid, got his adrenal glands jump-started again, improved his nutrition, and he dropped down from like 7 of the medicines down to 2 of the psych medicines, which was huge for him. Mm-hmm. And I remember the day very specifically. His wife came up and kissed me on the cheek in the office. She said, "Thanks for giving me my husband back." Oh.
Mm. So is it true that you have your personal therapy pups in your office?
We certainly do. We certainly do.
She's giving me that question, so some of my closing questions actually are about your dogs. We can go through those now. Can you tell us about your dogs? What kind of dogs are they, and what are their names? And
yeah,
they were supposed to bring them.
Yeah, we were going to bring them today. My my one pup had an injury, so I thought it best not to bring her by here today. But yeah, they're Ray and Lulu, and they're Keeshonds, and we had them when I was in practice back in Colorado. And actually, there's a Dr. Sinatra, who's a famous cardiologist out in the East Coast, and he's a regenerative and holistic oriented cardiologist. And he encouraged me to bring my dogs into the office when I had my Colorado office. And I asked him why, and he says, well, he would take the dog from room to room to see the patients, and he said the dog would oftentimes give him feedback on what's going on with the patient that he wouldn't have gotten otherwise. And so I thought, okay, I'll try that. And so we had these pups with us in Colorado, and I had an IV set up where we had 6 IV chairs and treated cancer patients with regularity, and they would always go over and sit next to this one fella. And I thought he was doing okay, and he always told me he was doing okay, and his lab work didn't say otherwise. And the dogs would always go and sit next to him when he came in for his IVs. And I thought, that's funny, because everybody else treats the dogs well. And so I thought, well, I'll take Sinatra's advice and I'll do a little more extensive lab work. And sure enough, this poor fellow was, his cancer was beginning to accelerate. When the initial tests we had done showed us that things were under control. And I attribute that in his life improving, and as does he, that the dogs were able to pick up that there was something wrong with him and gave me the feedback, and so they're the ones who inspired me to do further testing. So now, in our office in Laguna Hills, our dogs come with us to the office, and I use their input, because they tell me things all the time.
Do you have pictures of the dogs on your phone?
I do, but I have to transfer it to it.
I'm not going to just put it up to this camera. If you just pull up the photo.
Let's see here.
Yes.
And then I can just show them.
We have to see them. They are the cutest.
Hey, Brian just joined us. What's up? And some other closing questions. It's been almost an hour now. Okay, you can just, here, I'll just hold it up to the camera. Tell us, is it right about there?
Oh, yes.
Can you see it?
Yes.
That's Ray on the left and Lulu on the right.
Yeah.
All right. I can't see it in real time. Are we good?
Yes.
You're not looking at the camera.
They are really, really cute. Oh, I'm sorry. No, I'm looking.
Okay. I'm just because my screen is delayed that I'm looking at. So there you go. I'm trying to get it closer.
Okay.
There you go.
They're very cute.
Okay, they're the dogs. They got a nice, good view of those for a while.
They're nice and calming, and the patients that have been coming through, I can just say recently that have had some problems dealing with cancer have just mentioned how nice it is to be able to have their presence and how calming they are. Just it raises their spirits when they're there getting treatment.
Awesome. Yeah, my kids bug me to get a dog. I'm glad they don't watch this broadcast. Last couple things before I know I posted this in the Irvine Moms page. So again, just want to hit because we have a lot of young families in Irvine. Irvine's a family town. As a parent myself, as I said, as a pediatric doctor, what advice do you have for young parents with young kids and/or new babies?
Okay, new babies. Okay, let's start.
General advice.
Moms, if you can, breastfeed them. Gee, if you can breastfeed them, you're giving them the best start that you possibly get them started on, because you're giving them immunoglobulins. We had a question earlier about IVIG. Immunoglobulins are your body's immune system trying to defend you against the outside bacteria, etc. And moms, you're transferring that right directly to your baby, so you can't do better than that along the way. Okay. Stay away from the processed food. Make as many of the foods as you possibly can. Stick with organic if you possibly can. Keep the sweets out of the kids' mouths. Stay away from all the sodas and all the colored drinks, all the suckers and things like that. And your kids are going to be healthier. Diet is number one with little kids and what you're feeding them along the way. And if you keep them away from the junk, they're going to be healthier, and you'll have less issues with illness.
That's like the single biggest challenge I have with my kids.
I know, because the commercials on TV tell them that you got to have McDonald's and all this other baloney along the way.
Yeah.
And if you can feed them the good foods and introduce things to them early on and encourage them to try, and don't force children to eat things along the way, but encourage them to try a variety of things. And the more colorful the foods, not only they're more appealing by looking at it, but it's also been proven they have higher antioxidant contents in the more colorful foods along the way. And so introduce a lot of colorful foods into their diets, and the kids will be healthier for it, and you will be happier for that as well.
Awesome. So, a couple clinics in closing, if you got anything. What has been the most rewarding thing about being a doctor? Or probably more than one thing, probably a bunch of things.
I guess just being able to be a part of people's lives and to improve the quality of life when they've given up all hope.
Oh, again, you made me cry because you've been kind of part of my family for a few years now. You know all my friends, you know my whole family, and thank you for supporting what we do in this campaign. And I think we're going to win it this time.
Amen, Mark. We're praying for you and we're pulling for you, and we're going to tell everybody about you.
What was it for evil to thrive? Good men just need to do nothing, right?
That's right.
And here, this city's no different.
And you just stand up there and just tell them like it is, Mark.
Yeah. Well, I wear those political attacks like a badge of honor these days. So I really don't care.
Yeah. God is happy with you. I know that.
The best I can.
God is
thanks. Thanks for supporting me. We don't kind of hang out. Oh, one of my lights went out. I guess we've been going too long. Anyway, Bonnie says, I'm sure grateful you were there for us. So you have one of your other patients.
Yeah.
So
Bonnie's always so special.
Do Dr. Thermos a favor and spread this broadcast and tell everybody about his private practice in Laguna Hills. And you'll probably see me there. That's where I go every few months for my blood checks and all that stuff. And Dr. Thermos says eat healthier and eat more protein, the same things. Every time. And on this campaign trail, it's like a challenge because I've got it's 6 p.m. and I've got a long list of things to do, and there are little nitpicking mosquito bites already kind of hitting the campaign, little things. As I suspected, they try to come after my tech, but I'm pretty good at that stuff, so it'll be okay.
Well, if you go to Ephesians and put on the armor of God to start out with every day, you will be protected, and just know that God has your back as well.
Well, I'll do the best I can. We're just going to campaign. I think we're doing good. We have a lot of people that remember us from the last campaign 2 years ago.
Mm-hmm. And you had a lot of support then. It wasn't until they started attacking you that you came across problems.
Well, they only attack you when you're doing good. When they know you're going to win. That's it.
As an old mentor of mine used to say, they can't stab you in the back unless you're out in front, right?
Yeah, that's pretty much what it is. I see it going pretty good this time. Very low stress. Anyway, I don't make it too much about me. I want to make more about you. And
well, I'm pleased to be here and thankful for the opportunity to be here with you, and you know that I support you in this whole campaign and want to help tell everybody that I can and see if we can't change things and make things better for the city of Irvine.
I think we will. Were you willing to come back in a couple weeks and do this again?
You betcha.
Awesome. Did you like the setup? Was it comfortable?
Yeah, it was very comfortable here. It was really nice, especially having the two of you guys here. I mean, that's what made it really easy.
I love seeing you always. On good health only.
So we got 7 people still watching us live. So there's one of my friends actually. He's just retired from the military. He's older too. Sorry, John, you joined us late, but he would have benefited through some of the advice, I think.
Yeah.
Well, maybe we can come back and talk again here, John, and be glad to give you some direction. You can store up some questions in advance.
Well, you're tagged in this, so people ask questions, you'll see their questions on this.
Oh, okay.
On Facebook. And I'll probably promote it, probably get a few thousand views and everything, so we'll see how it goes. And the key with this is consistency, so do this every week or two.
Sure.
And then we still have to go follow up with like Sterling Koliba, the guy he has a master's degree trying to find a job. Mm-hmm. Also Greg from Uplift Transport, the Army veteran, the medic. Mm-hmm. He transports disabled people around Irvine. Irvine-based veteran business for the disabled. And we were able, through just luck of the draw, we got him hooked up with the right person. He's looking at, I think, a contract right now with Hoag Hospital.
Good for him.
For the transport, so he's already got paying customers. He's driving around and...
Well, we're looking to get hooked up with the Wounded Warrior Project, because the Wounded Warrior Project has a whole thing going on where they're using hyperbaric oxygen in order to treat a lot of the patients with PTSD, which is one of your questions that you were asking about earlier. And there's a lot of data out there just talking about the use of hyperbaric oxygen in PTSD and how patients it's helping them along the way. So I'm hoping to get involved with the Wounded Warrior Project and start treating some of those veterans as well.
And you do have a hyperbaric chamber at your office?
Oh, I certainly do.
Okay, just wanted to point that out too. I remember seeing it, but I've never been in there.
Yeah. That's
great.
Well, I learned a lot about your history. I didn't. Most impressed like the pediatrics. I was hoping that you would have some training in that, because the moms that follow me, and I didn't realize at the Jackpot Doctor. Like,
oh yeah, that was fun. I was one of those guys who, when that's when all the issues started happening with regard to like a lot of the vaccines, and they started vaccinating a lot of the kids right out of the womb. Mm-hmm. That's when I was a resident back in the early '90s, and so I always was able to, just because of my holistic background, always figured, oh, that's not such a good idea. So I always looked for little nooks and crannies, little ways that we could avoid some of those things along the way.
Yeah, the anthrax vaccine messed up a lot of people, and it actually went where it was a Congress or Senate or something, it stopped it for the soldiers. Yeah.
Yeah, that's a whole big political situation. I think we could just have one broadcast just dedicated to those sort of issues.
I'm not afraid of it. I'm not running for school board anymore. That's a very testing. But with what we did, we were running for school board and we switched last minute. School board kind of likes me now anyway. So actually bumped into the mayor this morning. That was an interesting conversation.
Oh, what did you have to say?
I'll say off camera.
Okay.
But talked about some of the conspiracy theories, and kind of interesting what he laughed and what he didn't laugh about, what he knew and what he didn't know. So that was all interesting to me. I watch everything, try to take it all in, learn things from the most mundane discussions. You could learn a lot. Mm-hmm. But I'll reserve everything after the camera is off. So that was that today.
Cool.
But it's definitely fun as well. So we're good at this.
Well, keep charging on. We need more people like you in government, because we need to change the direction of this government that we have here right now.
Well, I think it's going to get better. Good people just have to stand up to bad guys. That's about it. And I think it was actually worse before. A lot of these truths and facts are coming out. We have these groups locally that watch and what's going on, and they expose and they publish documents that are factual, not opinions. So it's getting interesting. And the general public in this city anyway is becoming more and more aware.
I think overall people are more educated, and with the advent of the internet, they have access to information that they didn't have access to before.
Oh, hands down. I'm very proud that we're the #1 leader in social media in Irvine, hands down, for politics. Even at the county level, DA or the district attorney's race, Todd, nowhere near the penetration market we have, nowhere near the numbers, no way. They're really trying. They're spending money. They're hitting brick walls. They don't understand it. They don't know what we're doing. They don't know what they're doing. We keep hitting, just doing really good in the social media. And you have to like it. You have to like people. If you don't like it, you don't like people, you're gonna see those numbers. Just your page is gonna have 50 people. That's it. 50 of your friends that felt bad for you and liked your page. that's it.
Well, let's get you this Irvine City Council seat, and then let's move forward and let's think about Congress too for you.
No. Let's focus on this one and just take care of the people. It's just because they need, I was talking to people last night, and I said, if you're going to vote for me, do me one thing. And I said, what? And I said, stay in touch after that. Because I'm going to get elected, I'm going to go see Mark, you got it. I'm like, no, you need to tell me what to do after I get elected. Because I represent you, not me. You need to tell me what you want and everything. Email me. If you think something comes up, just tell me what to do and I'll do it.
And the great part about it is, I really know that you will listen to them. And that's really important.
That is the important
easy.
part.
You get 5,000 emails said vote this way, and no emails saying the other. You vote the way the people want you to vote on legislation. It's really easy. And if you don't know what you're doing, you talk to the people, talk to lawyers, talk to other leaders. It's not that hard. You just don't be out for yourself. That's about it.
But so many of them are just out for themselves.
Well, how many governors from Illinois are in prison? Or New York?
Yeah.
They call Chicago the Windy City, and it's only the 7th windiest city. And it's because Windy's also was a term for corruption, I guess, back in the day.
Oh yeah, it does. I grew up outside of Chicago,
okay,
in a place called Brookfield, Illinois, until I was 12, and so yeah, Chicago is renowned for its corruption.
Yeah, I've never been there.
Thoughts? Prevnar 13.
Okay.
Vaccines for immunosuppression.
There's
patients under.
I think we'll have to talk about that at another time here, Ed, because that's a longer discussion. But yeah. I appreciate the question.
Yeah, we've already been at 1 hour, so you want to cut the feed and then.
Okay. Cool.
You can stare at the camera and
Thanks,
smile.
everyone. It's been good to be able to have a chance to talk with you all. Please remember, everybody who lives in Irvine, please be remembering to get out and vote here, especially vote for my buddy Mark here. Yeah, I'm looking at the wrong screen here. Get out and vote for Mark, and be really considerate of your votes for all the candidates that are up for election here right now.
Thank you so much.
Awesome. See you guys.
Thank you.